The information presented in this podcast is for educational purposes only and is not meant to be a substitute for clinical mental health treatment. If you or someone you know is experiencing a mental health crisis, please dial 988 or head to your nearest emergency room. Welcome to the Black People Die by Suicide 2 podcast, where we discuss all things mental health with an emphasis on suicide in the Black community. I am your co-host, Jordan. Thank you all for tuning in. Today, I am riding solo. T-Kea is taking some time to fill her cup. She will be back. Don't worry. In the meantime, I am going to hold down the fort to the best of my ability. It's so good to have you all join us for another episode. If you're coming back, if this is your first time tuning in, thank you so much. Our show is all about raising awareness for suicide prevention and suicide awareness in the Black community. Because as y'all know, if you're tuning in and you're Black, this is something that we do not talk about nearly enough, but it's really impacting our community to a heavy degree, particularly right now. So thank you all for being interested in listening. We appreciate your continued support. So before we get started on today's topic, as usual, we always do a little check-in. And this is where we really get to tap into how we're feeling. Because so often people will ask us, how are you? And we'll say, we're fine or we're good when we're not really fine and not really good. But that's just kind of the way we're socialized to answer in a polite way here in America. But it is not always reflective accurately of what's going on with us. And then also, we are going to check in with our psychological fortitude score. And for those of you who have been listening, of course, that is coined by the esteemed Dr. Rita Walker. And psychological fortitude is basically like SPF for your mental health, is what she likened it to. So it's basically your barrier of protection for how well you're able to manage these stressors and pressures of life. And she likes to score psychological fortitude from 0 to 10, with 0 being, this is horrible. I absolutely cannot do this today. I'm having a hard time. And 10 being, I'm functioning at my highest level of self and nothing can break me down. So we'll also talk about our psychological fortitude score. And just so you all know, I am not really alone. I have two wonderful guests who I will introduce after I tell you all how I'm doing and my psychological fortitude score. So let's get right into it. How I'm feeling. I am feeling, I'm going to say optimistic again. And I've said that recently, but I think it's because I'm starting to feel my mental health turning around. For those of you who have been listening for a while, I had a bit of a rough summer. Full transparency, I was actually hospitalized over the summer for my mental health because I was experiencing some suicidal thoughts. But now I'm starting to feel a lot better. My medications have been working for quite some time. So I'm definitely in a much more positive headspace, which I'm very, very grateful for. So definitely optimistic and grateful. And for my psychological fortitude score, y'all know it's been pretty low lately, like 3, 4, maybe 5 at best. But today I'm going to give myself like a good 8, which is quite the improvement for how I've been definitely over the summer. So that's how I'm doing. That's my psychological fortitude score. And without further ado, I will introduce you all to our wonderful guests. So today I am joined by Carissa Henry and her daughter Mila to discuss youth mental health and their work in promoting mental wellness for Black girls through their nonprofit, Mental Health Boxes. So Mila is in middle school. They are down in Virginia, and Carissa is a licensed practical nurse, currently pursuing her doctorate in public health at George Washington University. Carissa and Mila, how are you both doing? And can you share your psychological fortitude score with us?
Yes. Hi, I'm Mila, and my score for today is probably a 7. I've had a pretty good day, and I think that I'm feeling pretty, good.
Mhm. We'll take good. Good is good.
I'm Carissa. I would say I am feeling a little bit down. I was actually physically sick this past week, so getting back in the groove of life has been a little bit rough. So I would probably give myself a score of, I would say a 5.5, 6. And I would say that I am doing better than I was doing yesterday.
Fantastic. Thank you both for joining us. We appreciate you all being here, and we're really excited to talk about this. We always look forward to having the perspective of youth on our channel because it- we feel like it's so important. Too often in our community, we're dismissive of the issues of youth, and you all are working to like directly combat that, which we think is a beautiful thing. So, on this episode, we're going to talk about youth mental health from the perspective of someone who is a mental health advocate, and that is Mila, really standing up for her peers and promoting good mental wellness in Black girls, which is fantastic. And this is particularly important because suicide rates are increasing for Black children. Emergency rooms are reporting that there have increased visits for Black girls in particular, experiencing suicidal ideation and suicide attempts. And I think I mentioned on quite a few episodes ago that during COVID, I worked in the emergency room and I would talk with adults who were struggling with substance use disorder. And I remember there was a point where I think this was like November, December of 2021. And we had this influx of kids that were coming in for suicide attempts or suicidal ideation. And I remember here in Maryland, there aren't very many programs for kids. So the kids would sit in the emergency room for like days with nowhere to go because all of the programs that we have were full. And I just remember thinking how much of an impact the pandemic really had on the kids. So this is something that I actually witnessed. And I think that's why it's so important that we have people like Carissa and Mila to talk about youth mental health and to advocate for them because y'all, this is real. I know we tend to think kids don't really have problems, but they do. So we want to talk about that today. So Carissa and Mila, both of you tell us a little bit more about yourself. Anything else you want us to know that I left out from the introduction?
My name is Carissa. I am Mila's mom. I am as you said in the introduction, I am a licensed nurse. I have a degree in public health. I'm actively pursuing my doctorate right now. And I've learned a lot about mental health over the years. I grew up in a white family. I grew up in a family that talks about mental health all the time, that I was in therapy at a very young age. I knew about medication options at a young age. And I had a dad who had multiple suicide attempts. I visited my father in the hospital for an inpatient stay after a suicide attempt on Father's Day, right? And being a kid, I remember laughing that he had no shoelaces in his sneakers because it was during a time where, as kids, we would change the colors of our laces or we would wear the really fat laces. And, as parents, you always like laugh at your kids at their style trends, right? And I remember he would always joke about that. So I remember visiting him there and he didn't have any shoelaces in his shoes. And that really stood out to me. So growing up, we really talked about mental health and we addressed mental health, right? Like we knew what that was. And then going through school and my career path and just everything I've learned, I thought that I was fully equipped with what I needed until I became a parent of, Mila, who really kind of started having some struggles around like age 11, um, not knowing what to do, right? And also feeling like I was forcing her to talk about things in a way that she wasn't ready to talk about them. And, I felt like I knew everything. And my husband, who never talks about mental health ever growing up, was very much like on the other spectrum of things. And we didn't really know how to meet in the middle and how to really help care for our child who really needed a specific set of support from us and a specific way for us to communicate with her. So, really this journey, I think, has taught us a lot, right? And as much as you've experienced or as much as you may think as a professional or, whatever, it is definitely a lot to learn when it comes to youth mental health. So Mila is now 13 years old, and she was given a really good opportunity at the beginning of this year through a very small micro grant through the Pete and Thomas Foundation with Southern Black Girls as well. And they provided her with money to do a project, and she focused her project on creating mental health care boxes. And she really enjoyed doing it, that she wanted to continue. And that's really how we developed her nonprofit.
Nice. That's fantastic. I think that it's so powerful that you took your own mental health struggles and really use that as a catalyst to help other people. So, Mila, in your own mental health struggles, how was that for you as a young person? I feel like we don't really give kids enough space to really talk about how much mental health issues impacted them. Like, what was that like for you?
At the time, I just really didn't want to talk about it. So it was also a difficult thing for like my family to go through, and like just like thinking about like what I did wrong sometimes, like why I was in the hospital.
Yeah, I feel like that's a really common experience. I know for myself, I would always think, what did I do to deserve this? Like, I always felt like I was at fault for feeling how I felt. But the reality is, mental health conditions are just like physical health conditions. I'm not really sure why we try to separate the two and kind of give more grace for physical illnesses, but it's just like a person who has diabetes. They're not, um, I don't know, intentionally trying to feel sick, or they have no more control over it than someone who has high blood pressure or cancer. It's not something that's our fault, but I think it's so common for many of us to feel that way. Um, how was it, I guess, for you during the pandemic?
You were separated from everybody. Like, I mean, like I had my friends, but like at the same time, I really didn't, because like it's not like I can just like go to my friend's house or birthday parties like I usually could. Like I would just have to call my friends like all the time, and we were all like just stuck in our house all the time and couldn't really do anything.
Yep, a lot of isolation. Mom, did you notice anything during this time?
Yeah, it was a hard time, and I think that it definitely complicated her mental health struggles, and we faced hospitalization kind of coming out of the pandemic and easing back into that, like kind of in school, kind of at home, and which, was great, but also a little bit still complicated, right? For these kids to balance, like, is today a day in school? Is today a day at home? And, how can mom help me with my homework that I don't understand when she has work to do? And, as a parent, I think it is hard and it feels very neglectful. But I I definitely think that the isolation and just kind of the adapting to a new normal was really sudden for them, and there was no way we could have planned appropriately for it. So I definitely think that impacted her for sure.
What inspired you to want to make care packages for other girls?
When I got discharged from the hospital, they gave me like this box of all this stuff, and like it kind of inspired me, I would say. So I just got some of my favorite stuff and put it in the box to help other girls out because I know that helped me.
You know what? I actually wish T-Kea was here for this episode because she really enjoys receiving care packages too, like whenever she's feeling down mentally. So I know that would have been something you two really had in common. Like it always makes her feel special and appreciated and like someone really, really cares. So it sounded like that's how you felt when you received that care package when you were discharged.
Yeah.
Yeah. Do any of your friends, I guess, struggle with mental health? Has it been easier for you to talk with your friends about this since you started mental health boxes?
Now I feel like I have like actual like true friends and I know like who my friends are. And like even with some of the friends I'm not as close with, like I know my boundaries with certain people and like I do have like a best friend that I feel like comfortable talking to and I feel like you just have to find the right person you're comfortable talking to.
That's a really, really good point. So it sounds like you've learned some really good coping skills from your experience because setting boundaries, even as adults, is not always easy. I wish that was something that I would have known at your age. What do you think is the most valuable thing that you've learned so far since you started mental health boxes and since you've had your experience overall?
It's okay to talk about my feelings when I need to because that's honestly my whole purpose for my boxes to make girls feel comfortable talking about their mental health and like to friends or family or anything. So it really just opened my eyes up and helped me feel more comfortable talking about it.
Mm, that's fantastic. I actually have a question for mom. How do you feel the mental health system for kids? How effective do you think it is down in Virginia? Because, like I mentioned, just out of curiosity, you all are our neighbor state from here in Maryland, and I feel like it's not really a lot of resources here. How has it been? I guess for Mila's recovery, but also trying to promote mental health boxes? Like, are there a lot of mental health spaces for kids there?
Um, so all right. I think there's a few different points I could make in response to your question. So we have a great children's hospital here in Richmond, Virginia. Fantastic. Mila has an absolute amazing primary care doctor. Her primary care doctor is uh, the reason we're in this position today because we've had a great relationship with her. She is attentive and responsive and she cares. And when Mila, ended up being hospitalized. It started off with a call from the school that then I turned to a call to the doctor that then turned to a call to crisis that then, and I feel like everything was in place and we acted upon all of the resources available to get her where she needed to be. Her hospitalization was good. I've never experienced that with my child before. So first time it was a good experience. I feel like they gave her great skills, great tools. Um, and that was great. Being discharged, coming out of it, you have to find your own provider, right? They refer you to the community service board and they have in our county, they have a walk-in. You walk in and you sit and you wait for an appointment and you get matched with somebody based on availability, really. So Mila didn't have an option to choose her therapist or choose her provider, right? She didn't have an option to really shop around or, because in reality, I know when I was a kid, I went through many different therapists. It didn't always work well. She walked into her first therapy appointment with, an old white woman on the other side of the table and was like, "How old are you?" Like immediately just not connected. And I think that's one thing that's really hard, especially when you're looking at girls who are biracial, who are Black. There are less than 2% Black women in mental health professions across the United States. And there are not enough mental health providers that are Black women to represent all of the Black girls who need mental health care. So when you're looking for that that representation, you're not going to get it. And that is really hard because that already, sets the tone. And Mila ended up warming up and getting along with her therapist. And, we did a lot of therapy, but we also had the resources to supplement that therapy, right? So we had the resources to say, oh, you want to try this journal? We'll buy it. Oh, you didn't really like that journal? Okay, we'll buy this one. Okay, $500 later on all the different try this, try that, we were able to, do those things, whereas some people might not have that. And I think where it becomes difficult as a parent is being able to support the ancillary needs, right? The needs in school that come about. What do parents know about 504 plans? What do parents know about IEPs? I've had conversations with her school before where they're like, she's doing really great now. Let's, discontinue her 504 plan. And I'm like, no way. We don't want to take that support away, even though things are great right now, because she still needs that and she might need that. And when she needs it, if she doesn't have it, it's going to be really hard, right? So I think for parents navigating the spectrum outside of just like finding a therapist or finding the right medication is knowing the warning signs of like, hey, is something happening? What do I need to pay attention to? Recently, one example I could say is Mila's teachers had said, she's not really focused in my class, and it was the same block, later in the day. And long story short, through conversation, it was easy to identify that like her medication is wearing off and maybe we need to adjust, and we talk with her PCP and we get that in order. But for some parents, that could have easily just been like a phone call. Your child is disruptive. They're loud. They're suspended. So without knowing as a parent, like what you can do to help protect them, I think is really hard. And I don't think parents are talking about it enough and saying that like my child has a mental health condition, or, for me, right? Like my child was in the hospital and I'm like, how do I tell other people that I'm a nurse and I'm this and I'm that? And how are we in this position? But, the more we talk about it and the more we support each other, the better it is, right? Because then you learn to share those resources. And same with Mila, like the more she talks about it with her peers and she has that peer support. So I think in general, there are definitely fragmented parts of the healthcare system out here. I think that we have a very unique experience where we have health insurance. We received a very, very large bill from her hospitalization, which I'm sure would deter many people from sending their kid back to, a mental health hospital, which is something we would like to help with down the road. How do we help provide financial assistance? And then obviously just they're overburdened, right? Mental health providers are overburdened. And really these kids need peer support. And that is kind of where we found our niche of, developing these care packages, getting them to girls, getting them to start talking about mental health and helping them support each other. And like Mila said, letting them know, hey, I've been there before. Everything's going to be okay. It's okay to have bad days. We'll get there together kind of thing, because there are not many organizations that are supporting that, especially supporting Black girls specifically with their mental health needs. So
Thank you for that. I always appreciate getting the perspective of parents who are helping their kids kind of navigate through the mental health system. And was just curious again, because we're in Maryland and I know it's tough, but I think what you spoke about will help some parents figure out how they can best support their child. So thank you for that.
you're welcome.
I guess tell me about the boxes in particular, and how do you choose what goes into the box?
I chose what goes in them based on what I liked. Like, there's a journal in there that I really liked, and I like to use it. There's a squishmallow. I have a whole bunch of stuffed animals. I like stuffed animals. They actually gave me one in the hospital, and I really liked it because it was really like nice and just comforting. And like there's a whole bunch of fidget toys in there too, and most of them is the stuff that helped me or the stuff that I actually used to help me like through my process or journey. And yeah, most of the stuff in there is just stuff that I like. So hopefully like stuff that helped me can also help other girls with their mental health.
Yes. What kind of feedback have you gotten from the girls that you've helped?
Uh, All the feedback is honestly good. I mean, one girl told me that like she experienced like a death with her grandma and the boxes were like really helping her. And just like a lot of girls say that the boxes are really helping them.
What do you enjoy most about creating the boxes and distributing them? What's your favorite part?
Probably just being able to hand them out to girls and like the boxes truly helping them instead of just like, like giving them out because everyone could use what's in the box, but it's a lot better to think about when you know you're actually helping somebody with their mental health.
Yeah, so where do you how do you all distribute the boxes? Is it mainly through like community events? Are you shipping them out? How does that process work for you?
So currently right now, how we're doing it is we have like an online ordering form, and we say ordering, they don't cost anything, but primarily it is other organizations, nonprofit organizations, or, some type of youth serving organization that will come and order a certain amount of boxes, and then they will identify and distribute. We also have schools that order them. We've had librarians, principals, social workers. We've had, physicians, different healthcare providers order them. We've had some parents order them. And then we've had actually some girls order them themselves, right? We don't necessarily like require any disclosure of anything to quote unquote qualify for a box. But we primarily do serve them through, other entities who are working directly with the girls in need. So we serve kind of as like that hub where they're getting it, then they are then distributing it to the girls.
So having that community support and being recognized for doing great things to help others, how does that feel for both of you?
I am honestly impressed. I mean, obviously, this is my daughter, my firstborn. I've been very amazed by her, for the forever. But I think that, just coming out on the other side of this and just seeing her resilience and seeing her want to give back and find purpose right when we had many years of like uncertainty has been really amazing. And she has gotten a ton of support in the community, a ton of recognition, a lot of people who are really admiring the work she's doing. And, just the purpose of giving back to the community and to girls in need, I think has been really amazing. And I'm just so proud of her.
Mm. How does it feel to be recognized, Mila?
That feels good. Just know people are like out here helping me with my organization and knowing that I have people like thinking that I'm doing good and stuff.
Yes, it sounds like you're getting a lot of support, which is so important. I think it really helps drive the work that we do when people kind of recognize the impact. And I have to say, I've never heard of an organization that's doing something like what you're doing with mental health boxes. And I think that it's so cool that, like, a girl owned nonprofit is out here helping other girls who are struggling with their mental health. That is huge. Like, do you realize that you're a trailblazer, Mila? Because you are. Like, that is so fantastic. And for you all to be, y'all are pretty, y'all are new? You haven't been around that long, right?
Nope, she just started in January of this year.
What?
Yeah.
See, and look how quickly people recognize, like, this is something we really need. If you have programs and doctors ordering boxes, like, the community realizes how much of a benefit this will be for other people. So I know that has to feel good that you're giving back and helping others. I guess a question for you, Mila. In what ways do you feel like we can help make children feel more supported if they're struggling with their mental health or with suicidal thoughts, or even if they don't have a mental health disorder? Maybe they're just feeling a little bit sad. How do you think we can best support kids?
I just be there for them and notice when something's wrong. And like, when I say be there for them, I just mean like being able to comfort them and just letting them know it's all right, even if they don't want to talk about it, because I hate being forced to talk about if I'm sad or something, or like I think that I've gotten to the point where like I'm comfortable talking when I'm ready. And I think that instead of like pressuring girls to talk about it, I think that you're more likely to get them to talk about it when you're not pressuring them. And just like, just having somebody like to be there for you behind your back, even if you're like not expressing what's actually going on, just knowing that you have somebody there to talk to when you are ready to talk about it.
So it sounds like empathy would go a really long way in helping kids, right? Because again, I've mentioned, and I think we've talked about this on prior episodes, particularly in the Black community. I know that we tend to be a little harsh on kids as far as like feeling like their problems aren't legitimate problems. Like if you're not paying rent or paying bills, that you don't have true problems. But we all know what it's like to be a kid and to go through all those changes. And I'm sure there's pressure that even I don't understand. I was born in 1990, so by the time I graduated high school, that was like MySpace was around. I don't know if Twitter X might have just come on the scene or not, but there's a lot of pressure, like from social media and stuff that wasn't even around when I was a kid. So I feel like we're too dismissive of the problems of children because what feels, what we assume are little problems are big problems to kids. Like this, their entire life, they have to manage school, their friend groups, relationships with other adults. So your teachers, your coaches, your mentors, your home life with your parents and your siblings. Like children have lives too. So it sounds like being empathetic to what children are going through would really go a long way to supporting them. Do you agree? Yeah, yeah, because I uh I was definitely one of those kids that got the talk to me when you have some bills to pay, or just how it is in our community. But I'm really
But
glad, Mom, that your family was open to talking about mental health for you growing up. How do you feel like that was beneficial to you when it came time for you to help Mila?
I think it helped me make educated decisions, right? Where, having a conversation about putting Mila on medication was not an easy conversation with me and my husband. And I knew he wasn't on board even before I brought up the conversation, right? Because I just knew what he believed in and what I believed in. And um, it helped me because it is a hard decision to make, right? Like, am I doing the right thing for my child? Am I being selfish by doing it? Am I being selfish by not doing it? You go back and forth on how you feel about it. But then I look back at myself and what I went through, and, I was on medication and I went to there, and I did all of these things as well. And I'm like, okay, it makes it a little bit easier to kind of say, I had this lived experience. I understand what she's going through. I can kind of validate my argument, right? Because at the end of the day, when you're in a partnership, you and your partner needs to make decisions together, right? It's not usually just one person. So it helps to come to the table with like valid points in what you're trying to get across. And obviously in making decisions, right, you want to look at things from both perspectives. So it was really good to have that experience, based on what I've been through. And then obviously based on my family history, my dad and my great grandma, actually, she committed suicide by hanging herself in Fairfield Hills in Connecticut, which was a big psych ward many, many years ago. And, I have family history of this, right? It's in the genetics. Like, we need to be careful, and I'm happy that I know about it and that we could pay attention to it, because we need to know, hey, these are risks and these are things that are in our blood and are in our genes, and we need to think about that as we are, making decisions for our kids moving forward.
Yes. Have you found, I guess, any members of your dad's side of the family? I guess, what's their feedback from the work that you've been doing? I think I asked something similar earlier, but do you find that it's easier to talk about mental health issues on your dad's side now that you have mental health boxes and they kind of see the success from it helping others?
On my dad's side, two of my like go-to people to talk to is definitely my grandma and my aunt. And I feel like I've always been comfortable to talk to them. Uh, I just feel like it's my dad that I have been working to open up more with. But
Oh, yeah.
I think that from my dad's side, I think my grandma and my aunt are like one of my like biggest supporters and like the people I go to the most to talk to.
And my
Yeah.
mother, she's a nurse, so she has, medical background, and even that still really didn't talk about mental health with her kids, but she'll say that, what happened with Mila really opened up their eyes as to, needing to address those kind of things. And, they are more open about talking about it. And my husband will say, like, I never really used to believe in all this, before what we went through, but now he does, right? It's different when it affects your kids and your family.
Yes, I had a very, very similar experience. When I first was hospitalized for suicidal thoughts, this was back in 2012 when I was 22. And it took my mom a really, really long time to come around. Black People Die by Suicide too. We are also new. We actually were founded, we started in May of 2023 as this podcast. And then the following month in June, we filed to become a nonprofit. So we are not that much ahead of you, trust me. We are we are also trying to figure this out. And I think it wasn't until probably earlier this year, I'm 34 now, that my mom really started to come around to understanding like mental health issues truly. It's a work in progress. So I don't want you to feel like what you're experiencing with your dad is abnormal, because even my family, it's taken them just a little while to come around. But I think the more they see the work that we're doing, the more they'll realize the impact and the value in talking about this. And that's ultimately what Black People Die by Suicide too is all about. Not even just getting people to talk about suicide, because even that's more taboo than just talking about mental health in general. But we're even trying to encourage people to talk about how they really feel. If they are feeling sad, finding safe spaces to talk about that and process that, because it can be a little bit tough in our community to do that. So I'm also trying to navigate getting my parent to understand. So I'm right there with you. Um, what's next for you, Mila, and mental health boxes?
Mm, I think that I'm going to continue and hopefully we can grow larger and get more like out of state um with this and be able to help growth all around instead of just in Virginia.
Yeah, that would be fantastic. Have
Yeah,
you received any orders from people that are out of state?
we have.
Yeah.
We have. So we've received some orders that we've been able to fulfill. We don't have much funding, but we have tried to fulfill some out of state orders when we can ship. We will do that. And we are looking for, more partnerships and ways to expand and get into other states, because there has been a lot of interest in growing that capacity and having this availability elsewhere. As of right now, we started off kind of just in like the Richmond area, and then we expanded to like Central Virginia, and now we've touched kind of like all over Virginia. We've gotten some boxes to girls in Georgia as well as Connecticut. And we're really hoping, we can continue to expand in the next year. We've delivered 1,080 boxes this year alone, in 10 short months. So the need is definitely there, and Mila really wants to be able to ship to different states. So we will be working on that.
Yes, I will see. I'm pretty sure I will get to add you all to our resource tab because we're always looking for resources for kids in particular. And we love what you're doing for Black girls. I think it's so important. Again, I saw so many kids come in to the emergency room that were thinking about suicide. And I remember many a night when I would come home and I would just cry because I knew what that felt like. Again, I've been hospitalized 5 times. So it really, I still think about it and fight back tears. So I'm really proud of you for using your platform to help other girls. And I'm also proud of you for the mental health work that you've done, Mila. I can't imagine what that's like for someone your age, but I tell you what, you sound like you're a lot more prepared than I am. You know about the boundaries and things that I definitely didn't know. You should be so proud of yourself. Here at Black People Die by Suicide too, we're proud of you. We're looking forward to whatever you have coming up next. We would absolutely love to stay in touch with you. I'm going to put the information for your organization in our show notes in our description box so that people can come check y'all out. Where can people find you?
On our website.
So our website is mhboxes.org. We are on Instagram at mhboxes as well. And yeah, those are the 2 places you could find us.
Okay. Thank you so much for coming. I guess for parting words, Mom, what advice would you give for any parent who is helping their kid navigate through some mental health challenges? And Mila, what words of encouragement would you give for any kids like you who are recovering from a mental health challenge?
I would say to just tell them it's okay not to be okay, and that it's not something to be ashamed of or scared to talk about, and that if anything, you should be open to talk about it because the more you talk about it, the more help you'll get on it. So just knowing that it's okay to have feelings that are other than happy or good or stuff like that.
Yeah, and that's full circle to how you started this by saying we're just so used to saying I'm good, right, in this culture. So I would have to say for parents, just to never stop loving your child and never give up on them. And there's no easy way to parent, we're all in this figuring this out together. It takes a village, and really just love your children because they grow up so fast.
Mila, Carissa, thank you both for joining us today.
Thank you. Thanks for having us.
Thank you to Carissa and Mila for joining us for this episode. Thank you so much for coming to talk about your work with mental health boxes and for raising awareness for young Black girls and promoting mental wellness and suicide prevention in this often overlooked populace. We're so grateful that you came to share all about what you're doing, and we wish you all continued success down in Virginia. So, for every episode, we like to shine a spotlight on someone who has passed away from suicide as a way of just keeping their legacy and their memory going. We feel like it's the backbone of our work. So often it's easy to be removed um, and wonder, like, who are these people that are dying from suicide? And they're Black people from all walks of life, um, all backgrounds, all socioeconomic statuses. Just it's impacting lots of people. And for this particular spotlight, I'm going to do my best not to become emotional, but it's very difficult to talk about, but very important to talk about. So for this episode spotlight, I am highlighting Kendrea Johnson. She was a first grader from Minneapolis, Minnesota, who died by suicide on December 27, 2014, at the age of 6. Kendrea experienced some hardships in her life that she ended up being placed into foster care in Minnesota. And according to several individuals, I guess some therapists she spoke to, maybe some people from foster care, social services, Kendrea actually talked about suicide on a few different occasions. And she even drew pictures about it and kept them in like a folder or a notebook that she had. Kendrea's death, ultimately, her family received a settlement for it from Hennepin County, again, in Minnesota, just based off the fact that it didn't seem like anyone took her suicidal ideations seriously enough to address them and for her to actually be kept safe. And this is particularly rough because she was only 6. And so far, almost positive that she's the youngest person that we've done a spotlight for. And yeah, it, especially after talking with Mila and Carissa and the work that they're doing, it's so important that we make space for young Black girls and that we listen to them and take their concerns seriously. To Kendrea, I don't even know what to say. I'm sorry, and keep flying high. And for today's resource, what better than mental health boxes? So Carissa and Mila are working to remove the stigma surrounding mental health among Black girls by providing curated toolboxes that promote self-care, resilience, and open conversations. Mental Health Boxes provides curated toolboxes with various mental health resources tailored to Black girls ages 6 to 16 in Central Virginia. And if you want to learn more about Mila and Carissa's work, you can visit Mental Health Boxes at mhboxes.org. Also on Instagram at mhboxes, and that information will be in the description box and the show notes. Again, they're trying to reach girls ages 6 to 16. Kendrea was 6. I'm so grateful that someone is working to fill this need. And for today's community change maker, we're highlighting Brianna Baker. She's the founder and executive director of Justice for Black Girls, a nonprofit that focuses on honoring the fullness of Black girlhood in ways that disrupt the systems that dishonor Black girlhood. This work elevates Black girls as the experts while creating space that enables Black girls to imagine a life beyond the confining structures in which they currently live. Brianna's work is both a space for Black girl safekeeping and a national rallying cry for us all to listen to, love, and affirm Black girls' genius and power. You can follow Justice for Black Girls on Instagram at justice4blackgirls or justiceforblackgirls.com. And again, that information will be in the description box and the show notes for you all to check out. And for this episode, oh my God, we got to shout out what we say to the kids. Talk to me when you have bills to pay and when you have food to put on the table. Depress those dishes. All the things that we say to the kids. And as we talked about earlier, just trying to make sure that we take the issues of children seriously and not feel like because they don't have adult problems that they don't have problems at all, because that very simply is not true. And for self-care, my favorite segment, I've been trying to tap into some creative outlets. So one of the things that I've been doing by way of YouTube University, they taught me how to crochet, and I finished my first project a few days ago, and I made a blanket for my dog for her bed for the winter. So I'm really proud of it. I'm also working on a throw blanket for myself. That's going to take me a little bit more time. I just appreciate the repetitive nature of crocheting, but I'm finding that I really have to pay a little bit more attention because sometimes you stitch into the wrong place and I got to go back and pull it apart. But I haven't felt frustrated to where I want to give up on it. Like, I'm really enjoying doing it. So, yeah, hopefully I'll be able to show you all on Instagram or somewhere the blanket that I make once I finish. But yeah, I got my dog's blanket done. Really enjoying it. And I'm also tapping into some other creative endeavors, which I will get to in some future self-care segments. But it's been bringing me a lot of joy and a lot of happiness. And I'm really, really glad that I'm experiencing some joy, because for a while I felt like nothing was really making me feel fulfilled. And I know that's a symptom certainly of my depression, but I'm happy that I'm getting into some hobbies that are really, really enjoyable. So things are turning around for the better. And for social media, y'all already know, check us out where you normally would check us out. Instagram, Black People Die by Suicide 2. We are also on Facebook and LinkedIn now, YouTube, wherever you listen to your podcasts. All that information will be down in the description box for you to give us a follow. And for our moment of inspiration, so many individuals are taking strides to promote mental wellness in Black youth, like Carissa and Mila. It's imperative that we provide safe spaces to listen to our youth with empathy and without judgment. We hope this episode will inspire more youth to raise awareness for suicide prevention and mental health challenges. Thank you all for tuning into this episode. See you all in 2 weeks. Until then, y'all take care.